You too. This doe is going to be having a C-section today. Right now, my vet is prepping her supplies, and what we're going to do is give her sedation drugs, and then as soon as she goes down, we're going to roll her into the skid loader bucket and use that as a table that can be brought up to the height that's comfortable for the veterinarian. Right now, the vet is going to give her sedation drugs, that's IV, and she won't be completely out, but it makes her less aware of what is going on and just unable to fight us during the process. So this doe had presented with a water bag, but really no other signs of labor, and she just wasn't progressing. After a considerable amount of time, it was probably well over an hour before I just gave my vet a call and said, hey, what do you think about this doe? She's really not doing anything. She had no contractions. She wasn't pushing. She was up. She was eating. She was very perky. You would have never guessed she was like even starting labor without that water bag there. And the vet said, well, give her a little more time. You know, maybe she just needs more. And I think I waited another 30 to 40 minutes, something like that. And I checked her and she was only partially dilated. And obviously that's concerning because if the water bag is already out, she should be progressing fairly quickly. So we waited an extra 45 minutes or so, still no progress. My vet said, well, I will head your way. It took her about an hour to get here. She said, let me know if anything happens in the meanwhile and anything changes. So she had gotten here, nothing had changed. I had tried to get my hand through the cervix because it was, part of the way open, but not nearly as wide as you'd like it to be. But her hands are much longer and slimmer than mine, so we thought there was a possibility she could possibly get them out. She reached her hand in there and realized that the first one that was right there had quite a large head, and it probably wasn't going to happen, and a C-section was going to be necessary. She had had plenty of time and was just not progressing into labor. Once we had her loaded into the skid loader bucket and situated, the vet went ahead and prepped the site by cleaning it with a betadine surgical scrub, and now she's going ahead and she's just putting lidocaine in, and this makes her all numb so that she can't feel the incision or anything that's going on. Once she has the entire site numbed up, we're going to go ahead and drape her just to keep the incision site clean. And here she's going to go ahead and start the incision. There's a couple layers to go through. She's being careful not to touch the rumen at all. That right there is the rumen. She's just trying to move it out of the way. And she's putting her hand in and fishing around for her uterus. Now it might seem counterintuitive to be cutting them open on the rumen side. However, if she made the incision on the other side, that's intestines, and that's much more worrisome. So here we recognized up in the corner, you can see her stitching on the rumen. When she made the incision, there was a very teeny tiny nick in it that I saw when it kept popping out. So she had a lot of gas in her rumen, which obviously is not ideal. And that kept pushing her rumen against where she was cutting. So unfortunately, she did get a little nick in it, but we got it all squared away and all stitched up. And now she is proceeding to try to get a handle on that uterus. At this point, her sedation is wearing off a little bit, and you can see her kind of move around, and she's giving her a little bit of trouble. Hey guys, after rendering what I thought was my final cut for this video, I realized that I misspoke a couple times, and I'm just going back and looking, and I just want to clarify something. When I say she's coming out of her sedation, she's not actually coming out of it. She's just becoming more active. So think of it like this. When people get their wisdom teeth removed and they undergo sedation, they don't remember anything that happened, but they're never actually out completely during the surgery, right? So that's why when you pick up somebody from the oral surgeon who's had their wisdom teeth removed and you get these funny videos of people talking and their mouths are shoved full of gauze and they're saying just really, really wacky things, they're awake. They don't remember it, but they're fully able to like function. There's 2 drugs that we give them to sedate them. And after that initial one kind of wears off, that makes them like real dopey, they're left with this dissociative drug. So her brain is disconnected from what's going on. So I just wanted to clarify that. You will see her start to move in parts of this video and seem to become agitated. She is still under sedation, just like somebody who undergoes oral surgery doesn't necessarily appear to be sedated because they can function, but they are still under the influence of sedation. But that rumen keeps popping out and is just getting in the way. So right now the vet has a hold of her uterus, and that's the foot she's holding right there, kind of the hock of the kid through the uterus, but this stomach is just getting in the way. So what I'm going to do is I'm going to reach over and grab a needle there for her, and we stuck a needle in the rumen. You can just see it in the upper corner, and we're just letting all the air out of that rumen just to get it out of the way. It actually took quite a while for that to go down. I cut part of it out of this video, but it really did take quite some time because there was so much gas in there, and it was just impeding her ability to do a good job with this C-section. So once we have that all taken care of, I'm going to pull the needle out, and now she has much more room to work with, and that little pinprick was definitely enough to heal up. So now she is cutting open the uterus, and there's that leg popping out, and this first kid comes out very quickly, fast and furious. The kid was crying and was pretty vigorous right away. I was reaching down to grab some towels and stuff. Obviously mom can't lick it off, and this was a cold day in February, so I had put the kid on a feed bag and was trying to rub it off a little bit, and mom was getting upset because she could hear it crying. So I ended up picking up the kid and just putting it up by mom's head, and she was very happy to start nibbling on it. And once I got the kid up there, she was settling down a little bit, but that kid was really flopping around and wasn't making it easy for me to also hold the doe, who was starting to wake up a bit, and the kid was flopping around, and I was trying to keep it from falling off the skid loader bucket. So this second kid actually took quite some time to get out, because this was a kid that was not stuck in the birth canal, but it's the one that had its head right there. I cut a really good portion of this out of the video as well, but she really had a hard time getting both of those legs out and turned around. So these are actually front legs, and right now she's trying to get the head kind of cranked around so it will come out, and she couldn't get its head up, so basically eventually she just pulled. Honestly, we were surprised that either of these kids were alive, because they were just in there so long. Like, all said and done, I think from the time I saw her water bag out to the time she got to me, we had everything prepped, and we actually started the surgery, was a good 4 hours. She did know that the first one was alive, that she could feel, because when she had put her hand in to see if she could reach through the cervix, she was able to feel movement. So we knew at that point it was alive, but by the time we got prepped for everything, we weren't sure. The water bag had broken at that point, and time is of the essence. At this point, she is stitching the uterus back up. She's putting the sutures in, and Then she will be cleaning it up. I'm trying my best to keep this doe settled down. She's coming out of her sedation. Her kids are crawling all over, so I said forget it. And right now I put them in a box behind us that has a warming pad in it to keep them warm. Unfortunately, I have a towel over her head here because that helps them kind of stay sleepy. Unfortunately, these kids were screaming for their mom and it kept trying to wake her up. So right now we're just putting some sterile water over her uterus and she's just cleaning up all those little blood clots and anything that could like cause infection. And we're gonna end up pouring the rest of this straight into her abdomen, and that'll just keep her hydrated. And and here she is getting upset, and at this point it gets a little harder because we can't touch the surgical site. The vet can't do anything. I've got water in my hands. I'm trying to keep her down with one elbow, hold the water with the other one, set that down. And ideally I would have reached for that back leg that was underneath her, but I could not reach it. And I couldn't put my shoulder into her to turn her around. So I'm trying to flip her just by using the front end and not touch the surgical site. So we were doing a little bit of acrobatics there, but we finally got her back on and settled down. Her sedation is wearing off fairly rapidly at this point, and her kids are in the background crying, and all she wants to do is get up and mother them, which is a really good sign because you know that she's made it through the surgery in really good condition and her instincts are still kicking in. So we're pouring the rest of this water into her abdomen here. Then she's gonna go ahead and start suturing the incision closed. So while she's doing that, I'll just talk a little bit about what happened with aftercare for these kids. We do think that she was early. She was on the way front end of what could have even been a possible due date for her. So these kids were very vigorous like the first few hours, and then they got very lethargic. I ended up pretty much keeping them in the house for 3 days. I'd take them out with me to do chores. I'd take them out to attempt to nurse multiple times a day. And every time I brought them out, she was a rock star. She tried so hard to get them to nurse, and she loved them very much. And she was doing everything she was supposed to do as a new mom. But the doling actually was way more vigorous in the beginning, and I thought for sure that the buckling was going to be a goner. And about 3 or 4 days in, they kind of switched spots, and all of a sudden the buckling was doing a little better, and the doe declined extremely fast, and she ended up dying. So I actually had to tube that buckling pretty much every meal for I think 6 days, and I was getting him latched on, but he wasn't that vigorous. And eventually we got to the point where I said, I can't keep tubing you. You could tell that he was starting to get hoarse just from being tubed all the time. He had a bunch of inflammation, and I just didn't want to put him through that anymore. So it was kind of do or die time. You cannot continue to just limp along and keep these things alive. At some point they have to do it themselves. He ended up really perking up over the next couple days and grew like crazy. Part of that is because he was a singleton and had all the milk to himself. However, he turned into an absolutely beautiful buck, and a C-section was absolutely the right choice for this doe, and I'm so glad we did it. He ended up being on my keeper list, and this is a picture of him now. He is 120 days in this picture and approximately 90 pounds. He's going to be a great herd sire in our program.